How do I know my breastfeeding is going well is a question we get asked all the time. It's just about making sure that we look at you and your baby. So firstly for you, when baby's feeding, are you getting any pain? Is your nipple shape the same size at the start and at the end of the feed? Is it the same shape? It shouldn't be different. It should look the same at the start of the feed as what it would do at the end of the feed. Do you feel like your breasts are comfortable? Are they emptying? Do they feel softer once you've had that feed? For your baby, is baby having 8 to 12 feeds in 24 hours? Are they having them, the feed, the length of the feeds, is it 5 to 40 minutes? Are we seeing that lovely suck and swallow pattern which we should be seeing? When the baby first attaches to the breast, it's that suck, 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 suck. And then it will be that suck, suck, swallow, pause. Suck, suck, swallow, pause. And near the end of the feed, it's them flutter sucks where baby's full of oxytocin, looks like they're sleeping, and they're just doing their tiny little sucks at the end. That's really important. That's your suck and swallow pattern. Is baby doing that? Can you hear your baby actually swallowing your breast milk? We also then want to make sure that baby's having wet and dirty nappies, and depending on the age of the baby. So a baby who's just been born, you usually get between 1 and 2 wet nappies, and usually 1 bowel movement, which is meconium, that black tar. Then around about 2 to 3 days again, you'll get around about 2 to 3 wet nappies. And you might notice that the bowel movements are starting to change in colour. That's fine. You might find that they're starting to go a little bit browner, a little bit green. That's okay, that's normal. At day 5, you will find that your baby will be producing more wet nappies. We'll be expecting your baby to have at least 6 wet, heavy nappies in 24 hours, and at least 2 poos in 24 hours. Usually a £2 size coin is okay. Breastfed babies can go a lot more, so please do not worry if your baby is going a lot more. If your baby is not having a bowel movement in 24 hours, we need to check. Make sure that attachment and positioning is all okay. We also need to make sure that baby's waking for feeds, is calm on the breast, is that normal skin tone for them, so they're not changing colour, they're not frustrated. If all of that's going okay, it sounds like you're doing a great job. However, if anything on that list that I've just mentioned you're not sure about, please pick up the phone, give us a call, let us come out. We're more than happy to just give you that reassurance if that's all you need, but you're doing an amazing job.